I think it's very common for our veterans, especially those with mild TBI, to deal with the frustrations of no longer being the person they were before and having that reality of being home and not only having to readjust to civilian life and no longer being in the military, but also having to readjust to this new self. So really going on a strength-based model, kind of focusing on what they have for resources, whether it be family or community support. In Tracy's case, it was more community. He does have some family, but no one that lives with him. So really reaching out and connecting with folks, because otherwise there's no one who's going to call and check in with him. For the folks who do have family, giving them some guidance on what to expect and how to deal with that and who they can call to help also, so that they don't get so frustrated.
The innate frustration that TBI patients feel, I think, is sometimes misinterpreted, especially by the family or even a provider. It's taken personally. Some strategies you might use for that are maybe distraction or lowering lights, turning off the TV, giving yourself some breathing room. It's not easy to deal with that frustration, but it's not something also that can be taken personally, because sometimes the impulsiveness of a person with a TBI leads you in a direction so that you're almost feeding in or aggravating them more. So you kind of have to take a step back, look at the situation, lower all the stimulus in the area so that the frustration maybe is lowered a little bit.
Probably one of the biggest concerns or complaints that the patients I work with have is the lack of understanding both in their immediate families and in the general community about brain injury. Particularly the general community, because their families are usually becoming aware. They're often misperceived as being crazy, or crazy and lazy are the two that I hear the most coming off the cuff. Patients who are being told that they're drunk or intoxicated because they have a impaired gait or their speech is slurred. And in general, the kind of stigma and fear that comes from people who don't understand what they're seeing and misinterpret it as something much more serious or much more threatening than it actually is.
It's embarrassing at first. I remember going to a physical therapy once and over in Smyrna Hospital, and they have the Starbucks there. And I love Starbucks. I was waiting in line. I had trouble ordering because my words, and the people behind me, I think they're around my age, and they're whispering about me, and they're like, "This guy, I think this guy's drunk. It's like 10 o'clock, and usually I'm pretty snappy with the comebacks." And I was afraid to say anything. Well, I was like, "Well, why didn't you say anything?" Because what am I gonna say? Even now I can't say much. Even if I would have, I'd sound drunk, a lot drunker than they thought I was. So, if it wasn't been for my friends and stuff when I first got home, I would have been, sitting at the house, I guess.
I wanted him to use his cane. He had a cane because sometimes his balance, or he'd kind of weave and wobble a little bit, and it sort of would let somebody know, kind of watch out a little, or there is something wrong with me. And he is always a person that is snappy with the comebacks, and it's sad to see that he doesn't feel confident to stick up for himself and say something, and I'd like him to have a shirt that just says, I have a brain injury because I was fighting for your freedom.
As far as me with my kind of like my anger and my just like kind of like my depression, just really I was really happy, and I was like, oh, it happens, it was a war, blah blah blah. I had done the same thing. Still in my head I think that, I'm like, well, it was, it could have happened to anybody, but now I'm kind of pissed off, and now I'm kind of like, screw this. This sucks. And honestly, it does suck, and I feel bad for the other people this happened to.
As more and more traumatic brain injuries are being diagnosed, it's important to understand its overlap with post-traumatic stress disorder. A recent study reported that 1 in every 5 returning veterans from Iraq and Afghanistan suffer from PTSD. Often the PTSD is undiagnosed. Until a short time ago, Brian was one of those undiagnosed. Now, with the help of his local vet center, he's beginning to cope with this challenge.
Vet centers help these veterans cope with some of the readjustment issues or post-traumatic stress disorder through counseling, one-on-one, develop a therapeutic relationship with them, build up the trust, then together, cognitively, form some sort of therapeutic plan to recovery.
No one ever talked to me about PTSD or any of that stuff because everything was about my brain. And talking to him about that stuff really kind of, set me straight, because I was like, why am I feeling like this? And why is my family suffering? And he's like, well, you realize, you got shot in the head with something, many guys don't live through something like that, And after that, I'm gonna, go to a place to help me with that, PTSD. And I mean, it's I didn't think it was that big of a deal. I kind of like, oh, it's just stress, whatever. I can deal with stress. I mean, it's the whole world is stressful,
There is a substantial overlap between post-traumatic stress disorder and traumatic brain injury, at least in terms of the symptoms people have, and it's very difficult to discriminate which of those two disorders is causing the symptoms. Doing that's important because treating those two aspects of the patient is often taking very different approaches. What we find is that adding to that complication is that both of these disorders aggravate the other. The brain injury impairs a person's ability to regulate their mood and deal with their trauma. The post-traumatic stress causes significant emotional distress that keeps the brain overwhelmed and disorganized and makes it harder for it to recover.
If we've learned anything, it's that traumatic brain injuries are by their very nature complex. However, through hard work, determination, and support, Tracy, Eddie, and Brian have all made huge strides in their recoveries over the past 2 years. Tracy is taking up skiing, using a bi-ski, plans to begin riding a road bike in the summer, and is planning to enroll at a local community college later this year.
If an aide stopped by the house today and didn't know much about the TBI, I would just tell them, I'm a little bit slower comprehending things. If you're asking me to go get something, I might head towards the refrigerator to get you something, and I'd forget what I'm going for. So just bear with me, that's all I can say.
Eddie's overall condition continues to improve, and so do his dreams for the future.
So what's your ultimate goal?
To run.
To run?
He said that. He wants to run.
Yeah, but...
To be a DI.
Oh, that's what I was looking for.
You still want to go back? You got to tell everybody what your dream is.
My dream is to get back in the Marine Corps.
And for Brian Wells, he now spends his time enjoying his children, playing basketball, snowboarding, and taking college courses with the thought of one day becoming a recreational therapist for veterans who have sustained a brain injury.
I think guys that have a brain injury, it does kind of suck at the first. You think, this is it. I'm gonna be this guy forever. But if I look back 3 years ago, I never would think that this is gonna be me. I never would think that I'm gonna be. I think the only problem that I can't do is drive, and that's only because of my peripheral. That's the only thing I can't do. I mean, I know everything else I can do. I didn't think, that I'd have my family here with me. Because a lot of guys, they get hurt, their families leave them. I didn't, guys that they get hurt, they just don't realize that it's not the end of their lives. If anything, it's the beginning. They have so many opportunities now.